her talk tomorrow is at Saturday at 10 a.m. And yeah, let us know. Her research or science breakthrough is called Unleashing Immune Cells on Autoimmune Disease. So what is an autoimmune disease?
So an autoimmune disease is a disease in which the body's immune system is actually overactive against self, against your own body. And this is oftentimes mediated by these particles called antibodies, which are supposed to protect the body from foreign invaders such as viruses, bacteria, fungi. But if the body somehow, for some reason, becomes overactive in producing antibodies against various tissues and organs, that can manifest as autoimmune disease. So these would include diseases like lupus, scleroderma, even diseases like multiple sclerosis that affect the nervous system.
How difficult, or is it difficult to treat autoimmune diseases?
It's very difficult to treat autoimmune diseases. Most of them do not have a cure. Most people with autoimmune diseases end up having a chronic disease for years and years. And really the mainstay of treatment so far has been suppressing the immune system to suppress that overactive, self-attacking immune response. And immune suppression leads to a lot of different side effects, including infections, severe infections, and also a lot of the medications we use for immune suppression can cause various organs to be damaged.
And so what you or your team won for the science breakthrough is not necessarily suppressing, it's going to be a different alternative therapy. So can you explain to us what that is?
Yes, so there is some degree of immunosuppression with this, but the promise of this therapy is that it may be a therapy that actually provides a significant period of remission of the disease, which most immune therapies do not do at this point. So what we have been doing is using the body's immune cells, T cells, and then engineering those to produce something called a chimeric antigen receptor, which is specifically targeted against a complex on the surface, or an antigen on the surface of B cells, because B cells are the ones that mistakenly or erroneously are producing too many antibodies against the body's tissues. So the idea is to have these other immune cells kill those B cells to eliminate that antibody production.
What led to even looking into using these types of cells for this therapy?
So we have been using CAR T cell therapy and other types of cell therapy for about 10 years in the oncology space. And what we have seen is that when we treat people with B cell cancers, so lymphomas and leukemias, we get a very deep depletion of these B cells in the tissues. And we see that antibody production stops essentially for most types of significantly important antibodies. So using that observation, we know that some autoimmune diseases are driven heavily by these antibodies. And there are other treatments that we have used historically that target B cells. So the idea is to use this treatment because it should be a one and done treatment. We don't know yet if it's going to be a cure for autoimmune disease. We're not promising that. But in cancers, in some cancers, yes, it is curing people. And we only give the infusion once, and then they require no further treatment.
What does your research look like? Are you just only, are you engineering these therapies? Are you doing clinical trials? Can you just give us a glimpse into what exactly is happening?
So we're doing a bit of both. I do not work in the lab myself anymore, but I run the clinical trials for a lot of these therapies. So I collaborate with others that are developing these, and we are producing a lot of these cells at our institution and producing new products that target various antigens on B cells, but also target other types of cells that are involved in the autoimmune process.
And when you say targeting, are you looking, what are we looking into? What does it mean to target something?
Sure. So if a cell is being targeted by the CAR T cells, it's literally being killed by the CAR T cells. So you have to be careful in that you're not killing cells that are truly vital to multiple functions in the body. And yes, B cells are very important, but the overactive ones are the ones we want to get rid of. And we can treat infections that are caused in people who lack B cells, and we can also give them supplemental antibodies if needed to treat infections and fight off infections.
And are you testing this therapy like outside experimentally before it goes into clinical trial, or is it just mostly finding information through these clinical trials?
So there are various products that are out there. No two CAR T-cell products are the same. There are differences in the design of the chimeric antigen receptor and also what the product is composed of, the levels of different types of T-cells, for instance. So yes, there are preclinical studies looking in mouse models mostly, but really what we learn most from is doing it in patients and people in clinical trials. Some of the side effects that we saw with CAR T-cell therapy in oncology in cancer patients, we did not see in the mice models. It wasn't until we treated people that we realized that there are some significant side effects that occur.
Mm-hmm. And I guess that's always been like a struggle when you are developing like a new therapy is the side effects. So like, is that something you're putting or keeping into mind as you further develop this therapy?
So that is one of the reasons that it has taken a while for CAR T-cell therapy to move outside of oncology and into other diseases, because in oncology, most of the chemotherapy and other regimens that we give people are pretty harsh. And so the side effects that we see from CAR T-cell therapy, they can be significant, but it is not worse than a lot of the side effects that we've seen in cancer patients. And most of the people who are treated with this therapy who have cancer usually have a terminal diagnosis. The CAR T-cell therapy kept a lot of people from having to go to end-of-life care or hospice. So the stakes are a little bit different. However, what we're seeing in autoimmune diseases so far, we're not seeing the same degree of side effects that we see in cancer patients. And part of the reason is because some of those side effects are due to the number of target cells that have to be killed by the CAR T cells. So in cancer, you have large tumors, and that killing of the tumor cells, that causes a very intense immune reaction, which causes something called cytokine release syndrome. Also can cause neurologic side effects. So what we're seeing in autoimmune disease is they don't have those large tumors. They have much fewer number of B cells that have to be killed. So we're not seeing the intensity of side effects yet. But the studies are very early. They're usually phase 1, phase 2 studies, and we've not treated the number of patients that we've treated in cancer medicine. So it remains to be seen, and not every autoimmune disease is the same. People have different organs involved, different risks, and so the side effects may look different in someone who has lupus versus someone who has multiple sclerosis.
So thinking of the fact that this CAR T therapy can be technically applied to these different autoimmune diseases, are you focused on just like looking into one to seeing if it just works for, say, just lupus or MS?
So the way that the trials have been designed so far is that we do enroll different trials or different cohorts on trials for the different diseases. And that's because every disease, there are different requirements. There are different inclusion and exclusion criteria. People have to have a certain level of disease, certain level of organ involvement. So we're looking at these for instance, we'll take one CAR T product and look at multiple diseases, but just separate the patients out by their disease.
Okay. Well, if you want to hear more about her science breakthrough, she will be presenting tomorrow at 10 a.m. I don't remember the room number right now, but just look it up on the program. But we have time for one question before I bring on my next guest, who is also Science Breakthrough awardee. Any questions? Oh, we got one. I love you. We're going to get you a mic. One moment.
Thank you. Is it possible that the therapy would work for people in the early stages of autoimmune disease versus later stages, and later there's almost nothing that's going to help?
Yes, that's a good question. And we are looking at people in early stages and in late stages. When people are in the late stage of an autoimmune disease, they often have lots of destruction of organs and tissues. So you cannot necessarily get back a lot of that. Some of the fibrotic or scarring changes we see in some diseases, we have seen some reversal, but not we don't think that that's going to be significant. So yes, in the early stages, it may work better, and it really, what it does is it sort of resets the immune system, and it allows new naive immune cells to be produced after the immune cells are all killed off by the CAR T.
Thank you so much for your question, and thank you so much, Monalisa Ghosh, for joining me on stage. A round of applause for our first guest. We're about to start, or we're starting now. But